Okay, let's talk about the impulsivity factor of narcissists, sociopaths, and psychopaths. So, a narcissist is generally not an impulsive person because they are so focused on having a positive self image. So, they're more than likely not going to do things that would draw negative attention to them. However, sociopaths are very impulsive, they have poor planning, and that often leads to frequent mistakes. And then psychopaths have very low impulsivity and they are very controlled and their actions are premeditated. So when a psychopath does something, it's because they've thought it through and they've meticulously planned it out. It's never going to be an impulsive, spur of the moment decision. It is going to be a very calculated decision and for a purpose that probably only they can understand and only serves them. So, their social interaction, narcissists are very good at maintaining appearances in their work and family life because it boosts their ego. So, you'll see a narcissist that is like very family oriented on the outside, but in actuality, they're probably not actually like that at all. Um, like with my ex, he would always take on other people's kids and call them his own, and he would help raise them and do all these things. And so on the outward appearance, it seems like he's this amazing person. Like, this guy's taking on other people's kids. It wasn't because like he really genuinely cared or wanted to be that person. It was because it made him look like a saint. It made him look amazing and it boosted his ego. And because people were always like, oh, you do so much for other people, this is amazing, blah blah blah. So it was just solely an ego boost. Moving on. So sociopaths struggle with normal life. They're very antisocial and very disruptive, and it's because they can't control their impulses. So it very hard it is very hard for a sociopath to have a quote normal life is what we would consider normal. So psychopaths often appear normal, but all they do is mimic emotions and exploit others. So yeah, nothing is genuine with a psychopath. And the violence and aggression factor. So like I said before, narcissists are rarely violent. They're they are more the passive aggressive type person or they're verbally abusive. But it's very rare that they would be physically abusive because of the negative connotation that would be tied to their personality. And they don't want that because image is everything for them. However, sociopaths are very prone to violent outbursts because of their impulsivity. So, like I said before, like my ex has a really long rap sheet, and a lot of the charges, as I've gone through them, are for assaults for various, for whatever reason, I don't know. Um, but that's why, as I'm going through this, I'm like, okay, he has high narcissistic tendencies, but then he's very impulsive, and he makes rash decisions. So I'm like, okay, you don't fully fit into the narcissist mold. There must be something else going on. So that makes me think that he has some parts of being a sociopath because of the violent tendencies and violent behavior that he has displayed and the violent traits that he has. But psychopaths, however, are only violent if it serves their goal. But if they are violent, it's because they calculated it and the outcome was better for them to be violent than to not. But they also are very calculated in their ability to avoid detection as well. So if they are violent, it's probably not going to be as easily detected as a sociopath. So let's talk about the treatment potential. And I kind of find this funny, I guess is the best word, because none of these personality types seem to be the type that would benefit from treatment or actually seek treatment because it wouldn't benefit them in any way. But we'll start with narcissists first, actually. So there is a higher chance of improvement with therapy with a narcissist because they will seek help for self-image issues. However, I think I've said it before. I think the only time that they would really seek help is because it would benefit them or they would receive some type of admiration or something like that, some kind of validation. And like I said before, like when you're with a therapist, you're with them for an hour tops, like maybe one time a week. So in that time frame, until the narcissist cover is blown, they can say whatever. But after a while, a good therapist will notice, okay, there's some inconsistencies or stuff going on. Something's not quite right with this picture. And then once the narcissist feels exposed, they will probably stop coming to therapy because now their image is damaged, which is what happened with my client that I talked about before, who I felt had high narcissistic tendencies, because after I found out that his story of how his wife was injured was significantly different than what he had told me, he never returned. And that was because that was a damaging blow to his ego. And then he knew that I would know that he lied. And so never came back. Moving on. So sociopaths, their treatment potential is difficult, but it is possible only if they are motivated for some type of purpose. So if they are court ordered to therapy, they might, but again, that is solely a means to an end. It's not because they really want to change, it's because they've been ordered to go. So I don't think the treatment is going to be as beneficial for them because they don't really want to change. They just have to for that moment in time so they can get out probation, get out of a sentence, whatever the case is. And then psychopaths are extremely resistant, and there will be little to no change because they have no remorse for their actions. So it'd be like basically talking to a wall constantly and trying to explain to this wall why they should care. The wall is never going to care. It's pretty much what a psychopath is. A wall human in a human body. So all three can be very harmful in relationships, especially like on the emotional level, because they will do actions that I'm going to say normal, to a regular person, a normal person, you probably wouldn't do them. And if you did, so let's say like cheating, most people can understand how detrimental cheating is to another person. And so, knowing that, and if you've ever been cheated on, you know what it feels like. So, you probably wouldn't do it to somebody else. But if you're somebody with these personality types who lacks empathy and lacks remorse, like they might pretend to care, might pretend to feel upset, might pretend to be sorry for whatever they did, but they don't actually feel sorry and they won't actually change their behavior because it doesn't benefit them to change their behavior, right? Especially if you're going to continue staying with them. There's literally no repercussion for their actions. And so they might behave for a little while and then probably a few months down the line, it starts all over again. And then you're in this constant cycle where you're like trying to explain to them how this affected you. They don't care.